All right, today we're diving into something that's nothing short of a revolution in African healthcare. We're going to look at how one single platform is taking on a massive problem that's been around for decades and what that actually means for millions of people on the ground. Just think about that for a second. What if every single part of your healthcare journey was just connected? A world where every doctor, every specialist has the information they need exactly when they need it. I mean, that sounds like how things are supposed to work, right? Well, for so many people across Africa, that seamless experience has been pure science fiction. For decades, the reality has been the total opposite. A healthcare system that you can really sum up in one word: fragmented. And look, this isn't just some minor inconvenience. It's a huge, continent-wide maze. You have to imagine each hospital, each clinic, each pharmacy as its own little island. They all have their own records, their own way of doing things, and they almost never talk to each other. This leaves the patients themselves trying to navigate these rough waters all on their own. And hey, don't just take my word for it. This is a critical problem identified by the people who know best. The World Health Organization itself points to this fragmentation as one of the biggest roadblocks to providing better care. It's turned patients into messengers, literally carrying their own test results and prescriptions from one place to the next. It's just not efficient. Let's do a quick tour of the continent so you can see what this actually looks like. You go to North Africa, and even with some really modern hospitals, the communication lines to the local primary care clinics are often completely broken. Then you jump over to West Africa, and the situation is even more complex. You've got this patchwork of thousands of independent providers, all operating in total isolation. No shared patient records. You can imagine the result: repeated tests, conflicting advice, and really disjointed care. Head over to East Africa, and you see this incredible boom in digital health tech. But here's the catch. All these amazing new tools, they don't speak the same language. They don't talk to each other. So you end up with a brand new kind of digital fragmentation. And even down in Southern Africa, home to some of the most advanced hospitals on the continent, just sharing patient data from one facility to another is still a massive challenge. So you see the pattern here, right? All the individual pieces for great healthcare are there, but they just aren't connected. Okay, so that's the problem. It's big. But what if you could finally build the bridges between all those islands? This is where our story takes a really exciting turn, from a continent of silos to a single, powerful, connected solution. So let me introduce you to AfriPharm Health. It's a platform built with one incredibly ambitious goal: to completely change the model by weaving all those separate parts into one single working ecosystem. So how in the world are they pulling this off? Well, their whole strategy really comes down to one number: 5. They've identified the 5 most critical pillars of healthcare and are connecting them all into one seamless network. So what exactly are these 5 networks? Let's pop the hood and take a look at how they actually form the foundation of this whole new way of delivering healthcare. Okay, so it all kicks off right where you are, at home. With the Homecare Network, you can report symptoms, and an AI helps figure out what's going on. From there, you can jump straight into the virtual care network for a video call with a doctor. Now, if things are serious, the emergency partner network gets triggered automatically. And here's the genius part. The hospital partner network gets a heads up, so they get all the patient's information before they even walk through the door. Finally, the pharmacy partner network takes care of prescriptions digitally. It's a complete end-to-end journey. So you might be wondering, what's the magic holding all of this together? Well, it's the technology. You can think of it as the digital connecting tissue that binds all 5 of these networks into one intelligent system. At the absolute heart of it all is something called the Health Vault. Now, this is your secure digital health record. It's got everything. But the most important part, you, the patient, control it. You decide who gets to see your data and when. And building on that, you have the Continental Health Passport. This is a total game changer for a continent on the move. It's a portable medical ID, which means your entire health history can travel with you, ensuring you get great care whether you're in Lusaka, Lagos, or anywhere else in the world. And to help people navigate this new world, there's Dr. Cheerful AI. Just think of it as your friendly 24/7 digital health assistant, always there to guide you to the right care and help you make sense of your health info. Okay. That all sounds great in theory, right? But what does this connected system actually mean for a real person who needs help? Let's walk through a couple of real-world journeys to see the impact this is having right now. So here's what that perfect journey looks like in action. It all starts with a request from home. That leads to a virtual consult. The prescription gets zapped over to a local pharmacy. If things take a bad turn, an emergency is automatically escalated and the hospital is ready and waiting. And even after treatment, the patient is monitored while recovering at home, all through the same system. Every single step, finally connected.
Let's make this super real. Managing a chronic disease is a huge challenge across Africa. So let's imagine a patient with diabetes living in Zambia. Let's see how their entire life changes with a system like this.
So instead of the constant hassle of traveling to appointments, our patient just reports their symptoms from home. They have a video call with their doctor, and their prescription gets sent straight to their pharmacy. But here's the key. Their medication use is tracked in their health vault, allowing their doctor to provide truly proactive care. This isn't just about convenience, it's just a smarter, better way to stay healthy.
Now, for a really high-stakes scenario, an emergency in Nigeria. This is where a connected system can literally be the difference between life and death. Okay, so a patient reports severe chest pain. The system's AI instantly knows this is an emergency and gets an ambulance on the way. But here's the game-changing part. The hospital they're heading to isn't flying blind. They already have the patient's medical history. They're already preparing. This means life-saving treatment can start the second that patient comes through the door. No delays.
So when you take a step back and look at the whole picture, it becomes pretty clear that AfriPharm Health is building something much, much bigger than an app. What they're really creating is a whole new vision for what healthcare in Africa can be, moving from a collection of broken pieces to a truly integrated whole. And honestly, this slide just says it all. On the one side, you've got the past, fragmented, reactive, with patients stuck in the middle. And on the other, you have this connected future. One patient, one record, and a healthcare system that's proactive and always prepared. It's a night and day difference. It really all boils down to this. One platform, 5 networks, a fully connected healthcare ecosystem. It's a simple idea, but the potential it unlocks is absolutely massive. And that really brings us to the big final question. This isn't just about an upgrade. It's a total reimagining of how things work. So you have to ask yourself, what really becomes possible when an entire continent's healthcare system finally starts working as one team? What does that unlock for the future of Africa?